is Dr. Elijah Kwasa, a radiologist at Stratus Medical, partnering with Ponea Health. Today we'll be talking about side effects of imaging procedures. What are they? What is relevant to you? And how can we avoid them? So there are many imaging procedures that I'm sure many of us have gone through, whether it's general radiography, CT, MRI, ultrasound, and rarely nuclear medicine, PET scanning, and that sort of thing. So it's important to classify these imaging modalities, and the way I would put them is we have those that cause radiation and those that don't cause radiation. So radiation means energy that can go into a substance and change its atomic structure. So basically, those that have radiation are general radiography, which includes things like fluoroscopy, CT scans as well, and any nuclear medicine procedures. Those that don't have ionizing radiation are ultrasound and MRI. Now, the main concern with imaging modalities that have radiation is that they can affect our cellular makeup. And this is much more relevant to younger people. So therefore, we are very particularly concerned with pregnant women because we are worried about the baby that's growing inside of them and children. So when we look at radiation safety, that's one major concern. We may not have enough time to go into the different parameters therein, but suffice it to say that in the most recent decades, technology has improved such that the amount of radiation you get from a study is much less. And so it's comparatively safer than what it used to be. But it is important, if someone is pregnant, to say that before they get any imaging modality, especially those that have ionizing radiation. For non-ionizing radiation, they're relatively safe. The one that we should mention is MRI. Why? Because it's a powerful magnet. So if you have anything metallic in your body, that's something that has to be notified before you go in. And for those who have electronic devices implanted in them, I'm talking of pacemakers, and for some with things like insulin pumps, it's important to let us know. Why? Because that magnetic field can actually disable this equipment, and that equipment was obviously put in to help you. So these are the major side effects when we look at this, but we can go into a bit more detail. Which detail is this? Sometimes you need dye to be put into your vessels. And the dye, again, are mainly two types. Let's say three if we look at ultrasound. The one that's given when you're doing an X-ray or a CT or fluoroscopy, basically ionizing radiation procedures, has iodine. Iodine is a relatively safe molecule. It's in most of our table salt, but in very high doses, it can cause problems to the kidneys. And also in people who may have kidney problems. What does this mean? Someone who is hypertensive, someone who's diabetic, someone who has pre-existing kidney problems, or indeed someone who's at an extreme of age. And in this point, I'm talking about the elderly. Their kidneys are relatively more susceptible to the injury to the kidney. Some call it contrast-induced kidney injury. Some call it contrast-induced nephropathy. It's important to check the creatinine levels before getting any iodine dye put into the veins. Now, if we look at MRI, it has a different type of dye. However, in those who already have a significant compromise in their kidney function, they should not get MRI contrast. Thank you for joining us for this discussion. You can book our services on ponea.com. You'll be able to visit us here at Stratus Medical. Feel free to join us again as we'll engage more in understanding how does imaging affect your life and your healthcare experience. Have a good day.